Hello all, today I will be talking regarding lung ultrasound 10 signs. The first sign is bad sign. It's a normal sign to identify pleural line. We should place the linear probe in between the two ribs. Then the two ribs can appear as two shadows, rib shadows, this anechoic, two rib shadows, and in between the two rib shadows we can see a white pleural line. This is pleural line. So this appears as a bad. So that's known as a bad sign. It's a normal sign. Now the A lines. So these are reverberation artifacts of pleura. This is the pleural line. So the reverberation artifacts of the pleural line can be seen as A lines. This is also normal line. Then the seashore sign. This is the normal sliding lung sign. And this sliding lung sign appears on a mode as seashore sign where there is a pleural line and above the pleural line there is a motionless horizontal part which is appears as waves, and below the pleural line there is a moving part which appears as granular pattern or sandy pattern. So this is known as seashore sign. Is also a normal sign. So we have covered three normal signs: bad sign, A line, and lung sliding or the seashore sign. Now coming to the fourth sign, stratosphere sign or the barcode sign. This sign is seen in pneumothorax where the lung sliding sign is absent. This absent lung sliding sign appears on a mode as uniform horizontal straight lines where the grainy or the sandy appearance is not seen due to the absence of the movement of the pleura, which is seen in pneumothorax. So stratosphere sign or barcode sign is a sign seen in pneumothorax. Next sign is the lung point. This is an ultrasonic pleural phenomenon that occurs at the site where the pneumothorax ends and the normal contact between the parietal and the visceral pleura is restored. So that's a point between the pneumothorax and the start of the normal lung sliding sign. So this sign is seen in pneumothorax. So we have seen two signs seen in pneumothorax, the barcode sign or the stratosphere sign and the lung point. Next is the shred sign. This sign is seen in consolidation where there is a defect in the normal pleural line below the consolidation. So this pleural line is not normal. It's seen as shredded. So this is known as shred sign. This is seen in consolidation. Next is tissue-like sign. Is also seen in consolidation where the tissue-like lung is seen with some air bronchogram. This is the pleural fluid. Here the lung appears as tissue-like or hepatization. It's like hepatic tissue, and this is the diaphragm. So this is tissue-like sign seen in consolidation. So we have covered two signs in consolidation, shred sign and the tissue sign. Next is the lung bracket sign where there are more than 3 B lines. B lines are the vertical lines which are obliterating the A lines. Okay, so if there are more than 3 lines, that's more than 3 B lines, vertical lines obliterating the A lines, this is seen in interstitial lung disease, or it can be seen in severe pulmonary edema. severe acute pulmonary edema. So the next is quad sign, which is seen in pleural effusion. This is a static sonographic sign. It's observed in pleural effusion where there is an anechoic pocket of fluid seen between 4 lines. That's 2 lines. The line joining these 2 ribs. In between the 2 ribs, then these are the lines. The line going through 2 ribs and the upper line, or this is the pleural line, and below it's the visceral line or the lung line. So in between these 4 lines, we can see an anechoic pocket of fluid, which is known as quad sign, seen in pleural effusion. Then sinusoid sign. So in a mode, there is a sinusoidal pattern. So this pattern is seen due to the movement of the lung line towards the pleura or the pleural line on inspiration, and it's coming back on expiration. So the pleural line will go, so the lung line will move towards the pleural line, towards the inspiration, and it come backwards during expiration. So this will appear as a sinusoidal pattern, and this is the respiratory variation of the pleural 2 lines, and this will lead to, you can see as a reduction in distance between the parietal and the visceral pleura. So this is sinusoid sign, which is seen in pleural effusion. So those are the 10 lung ultrasound signs. So let's repeat it. 3 normal signs, bad sign, A line, and the seashore sign. Then the 2 signs seen in pneumothorax, stratosphere sign and the lung point sign. Then the shred sign and the tissue sign, which is seen in consolidation. Then the lung bracket sign seen in interstitial lung disease, quad sign, and the sinusoid sign, which is seen in pleural effusion. So thank you. If you have any doubt, please email me. Thank you.